When I was about 21, I started to have troubles with my hips, both of them. But the first surgery that I had was not until I was 39. This full one was done because I have a pelvis that is full of holes. And the reason why it's full of holes is because when I was 10, I nearly bled to death from an infection in my colon, and they used steroids to get rid of it. And when you have 14 prednisone pills a day for 3 months and you're a kid, it really affects the bone and the way the bone forms later on. So it didn't really manifest itself badly until I was about 21.
Ginnie is a woman I met just about 2 years ago. She had about 7 surgeries. She had dysplasia, meaning her hips never formed properly, so she had hip replacements as a very young woman. The problem with having surgery at a young age is you have a lot of years left for them to wear out and problems to occur. That happened in both of her hips, twice on the right, 3 times on the left, and she had tolerated pretty much a catastrophically failed hip for the better part of a year before she came in to see one of our spine surgeons, who looked at her, got an x-ray and said, this isn't your back, this is coming from your hip. And her last revision surgery, the construct they had used had actually migrated inside of her pelvis and had worn away a hole about the size of a softball inside of her pelvis.
He's such an ingenious person because he took the hole that was in my pelvis and he inserted the cup into that.
We started the process of designing this custom implant for her pelvis. There's no off-the-shelf piece of equipment that allows you to rebuild that big of a defect. And so we get some specialized 3D imaging to create a 3-dimensional model. And then I worked with the design team to build essentially a giant piece of metal that would fill all the defects and provide extra stabilization for a new socket on that side of her pelvis.
Dr. Prioreschi is a genius. There is no question about it. He has a lot of background that supports that. I mean, his whole mechanical engineering background and the way he thinks about things isn't a normal way of thinking about them. He looks at them as puzzle pieces, I think, and then he rearranges them so that it comes out the way he wants it to come out.
We're talking about a $40,000, $50,000 implant. Some of the other hospitals I operate at have refused to let me do these kind of surgeries there because they know that it's going to hurt their bottom dollar. And so they've been very supportive. He just said, if it's what the patient needs, do the right thing. Surgery went well, everything is stable, and she's doing awesome.
You know, I felt safe, I felt cared for, and I felt like these people enjoyed what they did. It wasn't like just a job. I would say that this hospital has a lot of very brilliant people working in it and a lot of very creative people, so that if you think you have a problem, you should probably try to get here and see if it can be fixed by somebody, because it's just so worth it to be in your own, area, your own feeling of confidence that you're in a town that has such a wonderful place. It's a fabulous hospital. It has such great people in it. It has wonderful doctors and nurses. It has people who care. And that's what you need when you're sick.
Middlesex has something special in that it's not part of a large corporate hospital system. And so the bureaucracy is not so much that there's so many checkboxes. The best way I summarize it to the patient is it's small enough that the nurses are still allowed to care, as opposed to being constantly filling out forms, checkboxes, things to make the higher-ups happy. And so I think Middlesex stacks up neck and neck with any hospital I've operated at, including Cleveland Clinic, including Dartmouth, including military hospitals around the world. I think it's as fine a hospital as there is.